Have you ever felt stuck or just feeling sick and tired of not making progress on one of your most important health goals? Well, that's what we're going to talk about today on the podcast. And you know my story in this space, in that I was struggling, suffering in silence, thinking I could do it on my own, and just really wasn't able to up-level my health around drinking that I wanted to. And so I wound up hiring a health coach to help me do just that. And that's what we'll be talking about today on the podcast with my expert, Dr. Sandra Scheinbaum. She trains people to become functional medicine health coaches, helps practitioners and businesses hire them because she believes that health coaches are the key to combating chronic disease and reducing healthcare costs. As a founder and CEO of the Functional Medicine Coaching Academy, a collaboration with the Institute of Functional Medicine, Sandra is a leader in the field of health coaching education. As an educator herself and clinical psychologist, author, and public speaker for over 40 years, she founded FMCA at the age of 65 because rather than retiring, she was on a mission to grow the health coaching profession so that millions of people can get the support they need to lead healthier lives. The greatest joy in her life is being a grandma to twin daughters. So we talk about the importance of health coaching on this podcast and really how it helps people up-level their health and get unstuck. And so please enjoy this conversation I have with Dr. Sandy. Well, Dr. Sandy, I'm so excited to have you on my podcast. I've been a listener and follower of your podcast, and I just love the work that you're doing in the world. And as I mentioned in your bio when I introduced this podcast, I talked about functional medicine, and we've had other functional medicine doctors on the podcast in the past. But I really want to give our listeners a good sense and a good definition of functional medicine, because I think when we hear medicine or doctors, we have a tendency to lump them into a category, right? And I think there's a differentiation about functional medicine versus our traditional healthcare conventional medical system. Would you be able to elaborate more on what functional health and functional medicine is?
I'd be happy to, and it is a pleasure to be here. Functional medicine, is Dr. Mark Hyman, who's one of the biggest advocates, says it's just good medicine. And we're looking towards a day when all medicine will be functional medicine. Why is that so important? Because functional medicine is the medicine of why. It's the medicine of asking questions. Why does this particular individual have these health concerns this particular time in their life? And it looks at the body not as an isolated set of symptoms, each organ operating independently of the rest of the body. And that leads to then each organ being treated by something in particular, without any communication with other practitioners. For example, you might have a dermatologist, you get a cream for your rash. You have a cardiologist who's put you on a statin. You may have a psychiatrist who's gotten you on an antidepressant, but they don't talk to one another. And functional medicine is about the systems of the body. It's a systems approach, and it is based on systems biology, the idea that everything is interconnected. And so these symptoms that you're having are not happening in isolation. And it looks under the hood by the medicine of why. Why is this going on? By looking at, for example, discovering, and it could all be related to inflammation. It could be related to oxidative stress, which means your body is slowly rusting inside. Well, and then it leads to another why. Why is this happening? Why do you have chronic inflammation? Well, perhaps, most likely, the answer would lie in how you're living your life. Lifestyle factors such as what you're eating. Are you moving throughout the day or not? How are you dealing with stressors that are in your life? What's the quality of your relationships? What about your sleep? And so those areas is where the health coach comes in. And health coaches do not practice medicine. They're not practicing functional medicine, but they are the ones who are helping people to lead healthier lives because they're addressing these very critical lifestyle factors. And all of this didn't just become popular because it's somebody's theory. This is based on evidence. So it is evidence based, it's based on research, and it is not one size fits all because so much of medicine tends to be one size fits all. There's a medication, and well, it's good for everybody. But this is precision medicine. It's personalized. And for example, the foods that are right for one person might be very bad for somebody else.
Yeah, I love that definition because my podcast first came out speaking towards alcohol, and everybody thought alcohol was the problem. And so they just wanted to tell the person to stay away from alcohol because alcohol was, quote, the problem. And how I viewed it in my life was that it wasn't the problem, it was the solution to my problem. And let's just talk about what was my real problem. And that's why I'm such an advocate of functional medicine, because it doesn't just look at an isolated event and treat an isolated event. It says, oh, let's look under the hood. Let's find the root of that problem. Maybe I was drinking at that time because of I didn't know how to handle certain emotions, right? And so once I developed skills and a framework to handle the actual problem, the primary problem, the secondary problem of drinking went away. And that's why I love your analogy with functional medicine is really if we look under the hood and we get to the root of the problem, we treat the whole body and not just going after one symptom with one drug, another symptom with another drug. Another example I like to use that I've experienced with my functional medicine doctor after I switched and found one. I still have a traditional medicine, conventional medicine doctor for some of my things that I like to take care of. And then my functional practitioner that helps me is that when I was struggling with a bit of moodiness, depression, a little bit more anxiety as I'm heading into and am in perimenopause, and the sleep was becoming wonky, right? Well, there's a sleep medication they wanted to prescribe and an SSRI they wanted to prescribe for the low blues/depression or anxiety. And it's like, well, if the root cause is my hormones are imbalanced and we can fix that and maybe just be on one thing rather than all these other medications, that just makes sense to me that we would fix what the actual problem is rather than treat the symptoms with a Band-Aid. So I really love that approach. And now that I've been exposed to this, it just makes so much more intuitive sense. And it's a more holistic approach to treating the body rather than this siloed approach, as you mentioned. Now, when you work with functional medicine, what are some of the benefits you find that clients or patients experience by working with functional medicine coaches, functional medicine practitioners?
So the solutions are surprisingly simple. And I think that's something that when most people go into functional medicine, start with a practitioner, working with a health coach, they think it needs to be complicated. And you might find somebody who is going to tell you that, where you get a treatment plan, a list of recommendations that's a mile long. And often that's very appropriate. But sometimes it's the simple things. And so what people find surprising is that they get better and often get better quickly by going back to some very basic things. It does not have to be complicated. What am I talking about? Things like having a regular sleep schedule, just something as simple as that. And that can result in better sleep. So you change sleep hygiene. If it's turning down the temperature at night. So looking at those simple things first, and then in the morning, getting sunlight, if that's not possible because of where you live, you might not be able to have access to direct sunlight. But how can you weave it in? Even just looking out the window can be enough. Something as simple as a philosophy, like as soon as your feet hit the floor in the morning, you tell yourself, today's going to be a good day. That is something actually my mother always said. And BJ Fogg, who is a noted behavior change specialist, talks about this, comes in his book, Tiny Habits. And it's just something about an orientation to the day. And then getting outside, even if it's just for a few minutes, but getting outside, paying attention to your breathing patterns, and just going back to those basics can be, again, one change can cause a cascade of positive changes. And so the changes also happen very, very quickly. Often it has to do with paying attention to what you're eating, and sometimes things like looking at, are you getting enough protein, especially for women? That's something I'm really, really big on. And that is, especially as you get older, for women, we're not eating enough protein. And so just paying attention to that can have a huge, huge impact.
Yeah, great examples there. And as you're mentioning these examples and the advantages people experience, I'd love to get your take because I know I'm an advocate of coaching and health coaching. That's one of the reasons I do it. I see so much improvement when I hire a coach where it does lead to behavior change. And I think that's really important for people to understand. It's not just because you're weak or you can't do it on your own. Yes, that may be part of it, but it really translates into the behavior change. Can you talk about more about your experience with health coaches and how they're so beneficial for people when they're looking to make that habit change?
Sure. Well, I was a clinical psychologist for many, many years, and I didn't realize I was actually a health coach because at the time when I started practicing, there was no such thing. Life coaching was just coming into being in the mid 80s. That came from humanistic psychotherapy. And so the reason coaching is so powerful has to do with its roots. In humanistic psychotherapy, it's all about the client. They're called a client, not a patient, because that means they're not just this sick individual who's so damaged that they need years and years of psychotherapy. The idea is that it's client-centered. Now, when you are in a relationship with a coach and you are in charge, and that coach is supporting you, you have an ally, you have an accountability partner, you have someone, most importantly, who just listens to you. And especially today, people are not heard. We're isolated. We're lonely. We feel like we don't have that support anymore. And that's why a coach is so, so critical. And it is a coach relationship is therapeutic, but it is not psychotherapy. And I've seen too many times where psychotherapy can actually be taking the wrong path and you don't get better. And you just go week after week just talking about your problems and you come out of there stirred up, but you're not getting better. And you may have therapists, and I've seen this, where they never even ask about your movement throughout the day. Are you sitting all day? If all you had to do was get up and get some fresh air and take a walk, well, that is a good antidepressant, for example. Or moving into things like mindfulness or using a strength-based approach. That's why coaching is so powerful, because it is about problem solving. It is about taking you from where you are to where you want to be. And study after study shows a very critical thing that happens. It's called self-efficacy, empowerment. It's where suddenly, like, hey, it's not up to the doctor or somebody else to be in charge of my health. I'm in charge. I can take control. I know that I can make this switch in what I'm eating, and I'm going to be determined to do that so that I can take care of my future self. That's why it is so, so powerful.
I love how you mentioned that. That's powerful because you have this ally on your side. And I agree with you. That feels different than a therapist or patient doctor relationship. Now, I'm putting myself in the thought process of my parents, right? Like the older generation, they go to the white coat, the doctor's office, and they feel that they have to follow everything that the
Yeah.
doctor says. And of course, these interactions are brief. They don't really have, quote, a relationship. And they're very top down approach, right? And I hear that from some clients that I work with is that, they've been in therapy, but they don't really have this relationship that's empowering, right? It feels like they're dissecting the same problem over and over again, and they're not making much progress. Like the patient walks away feeling sometimes more damaged or like I'm just spinning my wheels. So I love how you talk about coaching and it's in its essence, it is powerful because you have that relationship and it is empowering and you are developing a more of a collaborative approach to solving whatever it is the client wants to solve. You're looking for strategies, you're listening to them for what worked in the past, maybe what didn't work, where they find their obstacles are at. What other attributes do you think are powerful in that coach client relationship besides, the active listening skills and the collaboration and the empowerment?
It is taking you where you are and helping you to form realistic goals so that you get to where you want to be. It's breaking down. So you mentioned, they might go see your doctor and you get a treatment plan. And there actually is research shows that, and this comes years and years ago, and those who, I think this was Dr. Bernie Siegel's work on cancer, but that patient who said, I'm in your hands, whatever you say, doc, fared the worst. It's the difficult patient. It's the one who asks a lot of questions, who doesn't just accept things, that fares much better. And so when you may have a list of recommendations, most people know what they should do. They can Google and get a lot of information. So it's not an information deficit. It's not lack of awareness. They know, oh, I should be doing this, but how do you get there? How do you start? And so a coach will help you to really make that decision. Okay, I'm going to start here. I'm going to start small and I'm going to start. And then they'll ask you in terms of the accountability factor. Okay, when are you going to do that? You said you're not walking because you don't have the right shoes. And so then they brainstorm what would be the right shoes. Okay, when are you going to go get those shoes? How are we going to get? Are you going to get them online? Is there a shoe store available? And it goes to the really significant, although minor details, but what could be important. And then they experience success. They report back the next week. It might be a text, it might be a conversation with the coach. Well, yes, I went and I got those shoes. Okay, now when are you going to take a walk? They're coming up with a plan, a schedule for when that's going to happen, how many minutes you're going to be walking. So it gets very detailed oriented, breaking it down. And it's not the coach who's telling them what to do. The client is making that decision. And note that I said client because coaches are not, unless they have a prior license, they are not doctors, they are not diagnosing, they're not treating anything, but they're providing that crucial support and accountability. And it is in that goal setting that where the magic happens, because then you see, oh, I did it. I did it today. Okay, well, maybe tomorrow I can walk 10 minutes more. And so then it becomes a habit. Then it becomes something where you're looking forward to walking, or you don't see a day without walking in the cards because it's like brushing your teeth. It's now habitual, and that's what we want. And that's what people are unfortunately lacking because we know that people are sitting on the couch more. They are not moving, and it's critical, especially as you age.
Yeah, yeah. And what you've highlighted there that I pulled out is a coach is really instrumental in getting people to take action. And I think without taking action, we can just dream, we can wish, we can blame, we can believe our excuses, we can look at our obstacles and they're like little hills, but we turn them into mountains and we think we can't overcome them. And what I really love about a coach who believes in you, who's your cheerleader, who's your champion, they get you moving, taking the action, right? It's not on them, it's on you as the client, as you said, but they look for those modalities that are going to help you take that action. And that's so powerful because without the action, right, we can have the best plan. If we don't follow it, we're just not going to be doing the work. So when we talk about health coaches, and I'm a big advocate for it because, of course, that's what I practice. And I love when you said we take these actions and we turn them into habits, because I think that's what we all want is we want these healthy habits that are going to give us, health span, lifespan, and have us feeling better as we age, right? And taking on those activities that allow our aging process to really blossom as we age rather than becoming the opposite, frail, having other people needing to take care of us, not being able to take care of ourselves, going into assisted living eventually, right? If we can prevent all of that, that's what I love about coaching so much too. It's more preventative than treatment. Now, if somebody's listening to this podcast and like, I just really love championing others and I think I would be interested in health coaching, what are some tips you would have for people or who would be a good coach to go into health coaching?
If you're a good listener. So people think they need to have a background in healthcare. That is not true. So we do have many people, for example, who train with us who are medical doctors, nurses. They may have had a career in wellness. Maybe they're yoga, Pilates instructors, personal trainers, and they're attracted to health coaching so they can blend the coaching with what they're already doing. But we also have many people who are studying coaching because it's for their non-retirement retirement. An example was a nurse who was in a hospital for many, many years, and she was in one of our first classes, and she knew she was going to be retiring from the hospital, but she didn't want to retire completely. She still wanted to serve. She still wanted to help people get healthy in a way that would suit her needs. And so she wanted to be an independent coach, started her own business. Other people want to work on care teams, work with doctors, or work in wellness facilities or do corporate wellness. Big need, and it is expanding. So some of the best coaches have no background in healthcare whatsoever. We have people who, during the pandemic, someone who was a corporate banker was burnt out, and she left her position and she became a health coach, and she's doing really well. She loves it. This is a career that brings people joy. And why am I saying that? Because we hear from our graduates. It lights me up when you have a session with another person and you see this light in their eyes and this aha moment, like, when they're asked, you ask them that question, like, what do you want your health for? And when you want to start, they have this aha moment, like, yes, I can do it. And I'm ready to start. It's really life-changing. And it is something that is so beneficial for the health of the coach as well. I'm saying physical health, spiritual health, emotional health, because you know that you are there with that individual. It's an incredible encounter. It is a growing profession. And again, the research shows you do not need a background in healthcare to be a fantastic coach. In fact, sometimes that even gets in the way. We have doctors who've said that we train by cohort groups where there are live training sessions. And this one physician, she said, like, I struggled more than these people who had no background in healthcare because I came in as like the doctor dictator. That was how I was so used to interacting with people. Like, this is what's going on with you. Here's your diagnosis. And this is what I think you need to do about it. That's not coaching. If we don't need other experts in our lives. That's why, it doesn't work to be told what to do. It's that crucial relationship where the client is in charge.
Yeah, I love how you said that because as a pharmacist, right, people come to us as experts, right? And we're used to just disseminating and prescribing information. And we think that once we give them the answer the right way, that they're going to go and implement it. And that's oftentimes not what happens. And so I love how you mentioned that piece of it, because that is one skill I had to work really hard at, is the active listening and hearing. And I call it like the undertone, right?
Yeah.
Sometimes there's the main complaint. It could be, my husband doesn't like my drinking, or my husband doesn't like XYZ. And yes, I understand that can be hurtful or not feel good, but sometimes there's an underlying current there that's not being said. And so to really tune in and listen to, like, that's one of the problems, but that's not the primary problem. So I love how you said the active listening, because that's imperative. If you don't have a coach that's really hearing for the right problem, the primary problem, you're just going to be chasing all these ancillary things and really never getting to the core of the matter for that person.
So true.
Yeah.
Yeah.
So it's definitely a skill set to learn. And I've enjoyed the process because I see where it's much more impactful. It's much more helpful to get people moving in that direction. And I'll tell you, this has helped my relationship with my daughter in parenting so much more than any parenting book, any program that I've taken to like be a better parent or learn how to be a better mom, or you think you have to do all these things. It was the active listening skill and the coaching that has really helped transform the relationship I currently have with my daughter, which didn't always be this amazing and this beneficial. And I've also noticed how it's helped my husband and I navigate, because people change as we age. And so to navigate those changing times, it's really helped me be more open, be more willing to listen, and less likely to just spat. Because in the past, I would just think I was the person with the answer and just throw it out the answer, and then that would solve everything. But it oftentimes was not what the situation called for. So thank you for pointing that out.
Oh, that's wonderful. I mean, just thank you for saying that. It really resonates with me. First of all, I think that it shows you have a special relationship with your daughter and your husband. And it's what we hear from our graduates. So many say, I went into this program. I wanted to learn functional medicine. I wanted to become a health coach. I wanted to have a different kind of practice for my professional life. And I didn't realize that it would be a personal transformation and how much improvement would be then in my relationships with my family, with my friend, my colleagues, because we were using that coach approach as well.
Yeah, it really is
very special.
So transformational. I mean, that's why I continue to do it. It's the beacon that has had the most effect on my habits, on my health, on my relationships. And I think that all ties together, right? When you've got all of these things working in sync, that's what I feel like. I wanted to call my podcast and my program Epic, right? It used to be Drink Less Lifestyle. And I'm like, well, now I feel epic in my life. I feel like by conquering that drinking thing was the first step to set out the ripple of healthy habits. And then it was the next step and the next step. And I have a program that helps women understand the food and movement and how all of these habits really make you feel amazing in your life. Yeah. And so very transformational. So if anybody is really interested in this as a profession, I also want to tell you, you're going to get the benefit of this helping you personally in your life. It's a beautiful thing. So tell people more about if they are interested in working in your program. I know you got into this as a later stage in your life, if you want to take us through your personal journey, and then how people can reach out to you and learn more about your program.
Sure. Well, originally I started out as a teacher. I trained learning disabilities. I taught a classroom. Then I taught teachers and supervised student teachers as they were learning to work with kids with special needs. And I had an interest at that point in what didn't have a name then. We now call it mind body medicine. I was doing workshop stress management for teachers and helping parents with stress management, teaching breathing techniques. And then I became a clinical psychologist, but I focused on physical health. I was seeing people with migraine headaches, for example, and helping them with these basic principles that we now call lifestyle medicine, and got involved with functional medicine as a psychologist. And around 2014, 2015, we launched our first beta class, and I approached the Institute for Functional Medicine. So that's where I had trained in functional medicine. They trained the practitioners, the medical doctors, and I was one of the few psychologists who took that training. I saw this need to train on a bigger scale, to train health coaches in this philosophy, because people were coming to me who were already coaches saying, we want to learn these principles. And so we launched in 2015 and have trained up to 5,000 coaches now. We're reaching almost 5,000 graduates. And it's a collaboration with IFM, Institute for Functional Medicine. So it's their faculty. We use their materials, their toolkit items, because one of the main things we're really focusing on is the power of collaboration. So many health coaches tend to they want to go it alone. They set up their own business and they're out there often going into areas where it's really not the practice of the coach. The coaches don't order labs or interpret them, for example. They don't give a diagnosis. And so what they do best is collaborate with those professionals who have the medical licenses to do those kinds of things. That's how they grow their business. That's what we teach. So we teach them how to work with other professionals so that if they're running their own business, they can grow that business. Or if they want to work on care teams, work in medical offices, but it doesn't have to be in person anymore. It can be, but more and more coaches are coaching remotely. So you can see clients from anywhere in the world. You are not bound as physicians are by state licenses. And that allows you a lot of flexibility. And what's most exciting is you can do this in groups. That's where the magic really happens. People get together and the power of that group where they're all making those decisions to change and supporting one another in the process. So it's an exciting field. It's a growing field.
Oh, I think that's so important and key that you mentioned that, right? The collaboration. I mean, I'm a part of a women's hormone network. And so I can help women with certain menopausal symptoms and understand their bodies. And as trained as a pharmacist, I could get into the lab work with them. But if they really want to work with a practitioner, I help them find people, right? I think that collaboration piece is critical because there's not everything that we can do on our own. And I think there's, times where it's helpful to have that collaboration, right? The doctor might be so busy, but want to hand off something like, hey, instill this healthy habit and work with a coach to do that. And vice versa. I might need a functional medicine doctor to diagnose some stuff or do some testing. And how can I support that patient? And we can work collaboratively like that. Beautiful example. So as we wrap up, where can you send my listeners to learn more about your program and then follow you or hear you on your health podcast, which is wonderful?
Sure. So they can go to functionalmedicinecoaching.org. They can follow us on Instagram. It's Functional Med Coach. Personally, I'm Dr. Sandy. That's DrSandi. And our podcast is Health Coach Talk, where you, Sherry, are going to be an upcoming guest. And we're looking forward to continuing the conversation with you on our podcast.
Yes, I can't wait. And you've had some wonderful experts on your podcast that I really enjoyed listening to and I've learned from. I take notes when I listen to your podcast. So thank you for putting out this work into the world because we know mental health is in crisis right now. Suicide rates are up, depression is up, anxiety is up, cancers aren't getting better. Like, we are in a state of health crisis and we can empower people to take so much responsibility and prevent these downstream effects from happening and really make our nation healthier. So thank you for coming on the podcast today and instilling us with your wisdom.
Thank you for having me as a guest. It's been a pleasure.
Thanks, Dr. Sandy.